Hello there, my name is Jonathan Friedman, and you are listening to 5 FAQs by EHN Canada. This is the show where we scour the internet for the 5 most frequently asked questions about mental health and addiction and ask an expert for their answers to them. Today, it is my honor and my pleasure to introduce my special guest and my brother, Michael Friedman. How are you doing today?
I'm doing swell, doing great.
Uh, we'll tell the listeners a bit about yourself. While cancer is associated with negative mental health consequences, Michael initially had the opposite reaction: full-fledged positivity and resilience. Only later on in life did he discover the full impact that his cancer diagnosis and treatment had on his mental and emotional well-being. As a cancer survivor of 12 years today, and a patient who has been through a half year of chemotherapy treatment, surgeries, and countless checkups for Ewing sarcoma, Michael has a unique understanding of what it means to be sick, recovered, and everything in between. Inspired by his experience, Michael chooses to try and live his life to the fullest as a full-time musician, producing and recording music for artists, playing drums on stages in LA, Texas, Vancouver, and his hometown of Toronto, and fulfilling his dream despite the many challenges that arise in such a precarious field. Michael hopes to navigate the mental and emotional challenges of navigating the long-lasting effects of illness and having a positive but honest outlook on life. What a resume.
All true,
All true? True story?
factual.
So, um, tell the listeners a bit more about your journey. Like, I know as your brother, we started out kind of working together. Me as a child and youth counselor, you as a social worker, but then you made a big shift to go into music. Tell me a bit more about that transition. It sounds like your own recovery was a big piece of why you made that choice, but let's hear it straight from the source.
So essentially, I was working, as you mentioned, like getting into social work, um, sort of trying things that like you were doing or our little brother was doing, and sort of feeling it out, seeing what I like. But over time, I realized I had to carve my own path. So I was working at a group home one day, and I was on the swing with a person I was working with, and I had like a eureka moment that it was time to sort of follow my dreams and go into music, despite um, never having learned that music was like a viable path when you're younger. Like, you get the doctor, lawyer, accountant, but you don't really get, oh, like you should um, play drums around North America. Um, so I kind of just jumped in head first, not really knowing what it would entail. And it took until even like last year where I really started reflecting on my life, where I've been, where I'm going. Whereas before that, I was just like going full steam ahead. And there are pros and cons to that, yes.
Totally. So, as we noted when we were reading your illustrious bio, that today marks 12 years of being cancer free, being in
Yeah,
remission, right?
remission.
What does that feel like?
It's interesting. I was watching a coming of age movie last night, and it came out
Which
the
one?
year. It's called The Way, Way Back. It's giving like a Little Miss Sunshine vibe, but in an alternate universe. So it has like elements of comedy, elements of drama, and it reminded me a lot of my like treatment course. So I think reflecting on those 12 years comes with a lot of like joy and being here. And then it also comes with analyzing like deeper feelings around what it means to be a cancer survivor and have that be a part of your identity.
So today, as the name of this episode will suggest, Michael and I are going to be talking a lot about his experience with mental health as a cancer survivor. But unlike some of our other episodes, this is a little less clinical. We want to talk to real people about their real experiences and get some insight from that. So, really excited to be talking to you about that today, Michael, especially today. Okay, let's dive into those questions. Our first question: how can someone manage anxiety and depression after cancer treatment?
Well, it's a big question. So it looks
We
different for
try.
everyone. Very good. It looks different for everyone, as most things do, I'd say. It's a lot of life isn't black and white like that. I think it depends on the severity, and I think it depends on whether the anxiety and depression are stemming from strictly going through cancer or whether there are other factors. So when you think of a cancer survivor and mental health, a lot of people will probably think of the mental health issues that stem directly from cancer treatment. But you may not necessarily think about For me, I was in high school, so you might not think about social dynamics in high school creating more anxiety than going through cancer. When I was in grade 12, cancer felt like, and treatment felt like a break from all the confusion of being a teenager. So, even 7 years ago when I was on a podcast, I was asked what my biggest challenge was in life. And my answer was self esteem issues. But I had said that after I'd gone through all this treatment. So I'd say it needs a person centered approach where we talk to someone and learn about where their anxiety and depression stems from, regardless of what we think might be the factor that's causing the most anxiety or depression. So I'd say it starts there.
Sure. And really appreciate you saying that. And I think in any situation, let's take something like cancer. It's the big word. You have a conversation with anybody, and we've had conversations with our family members before, after treatment, with friends. You bring up that you've had cancer or that you were going through cancer treatment. The room suddenly takes a huge shift. The focus becomes that cancer treatment, that experience. But that's not necessarily the function of why somebody might be experiencing other things. So you might have had, I'm not saying you specifically, but one might have an experience of a mental health concern before cancer treatment, independent of it completely. And then now you're going through cancer treatment, and that becomes something new. Both of those things are now a part of your experience.
They create like a third sort of factor, like cancer, mental health, and then them combined, and then a fourth one where it's separate from cancer. So that's why the person first approach is helpful.
Do you feel like when you came to that revelation, when you came to that decision that wasn't actually about cancer, it was about self-esteem, like where did that switch come from? What changed for you?
Like the realization that self esteem might be a bigger factor here.
Yeah, exactly.
I'd say, yeah, when I realized that, because when I got diagnosed and I started going through chemotherapy treatment, there was like 3 or 4 months where I was like super positive and happy and like, oh, everything will be great. And then on my birthday, a lot of my friends got into a fight. And I realized that those social dynamics were actually more stressful to me than vincristine or doxorubicin or any other medication I was going through. And I was like, why is that? This is like this huge thing. And then there's this stuff that should be small, but actually feels like really big. So I realized that part of the reason why I was feeling good is that the chemo and my treatment of this huge medical issue is actually putting me at ease from all these other things going on.
Really interesting. So I think that's a great segue into the second question, which is what strategies can help someone improve someone's mental well-being during treatment, post-treatment? Um, we have this big experience, but what are strategies that we can exercise to, maybe start to explore some mental health, and mental wellness?
One thing is being able to analyze what you have around you. So I was fortunate enough that I had family and friends and people doing fundraisers and bringing meals every week. And I had like a lot of social support. Other people don't have that social support. So for me, that's one thing that I could see as something I can lean on. Whereas other people, if they don't have the social support, maybe they can lean on making sure they continue in their hobbies or interests and things that they enjoy. So I think everyone needs to find that thing that keeps a spark going if they're feeling very weighed down by their life circumstance or situation. And then beyond that, I think challenging yourself to communicate openly while going through such a big thing can be very difficult, but can allow the people around you, the medical team, to really give you the best care and the most understanding. Because when you have a doctor and a social worker and whatever team outside your door in what's called rounds discussing your medical treatment, but you're just listening from the outside, it takes a lot of guts to speak up and talk about what you need. So if you are fortunate enough to have someone advocate for you, great. And even so, being able to advocate for yourself is a really good strategy.
Totally. And what about after treatment? You mentioned, you had that realization of the self-esteem concerns, like really much later on. Um, are there resources that you access after treatment, or maybe as a cancer survivor that you have access to that you otherwise wouldn't have had access to? Is there cancer survivor specific supports that exist?
There are, but I found them kind of later in life. So right after treatment, I was like, great, I'm not sick anymore. Went on my wish trip, as you know, and sort of reveled in like being treated, pun intended, in a really good way with, yeah, trips to Hawaii and great seats at baseball games. And then I sort of just went about my life, kind of like it became a part of my identity. But I didn't seek out cancer specific supports until probably this year. Yeah.
Did you notice a big like change in your mental health when you switched careers or started to make those big life decisions after treatment?
My mental health probably improved and improved and improved. And then it took a downfall for a year or so. And then now, this past like 6 to 8 months, have been on an upswing again overall. So from like ages, from like my treatment until maybe a year and a half ago, I was sort of not dissecting what that experience meant to me. I didn't have the same level of awareness that I have now. So now with this new level of awareness, I'm able to say, oh, maybe, I go to cancer fatigue services. I go to cancer survivor meetups, and I engage in the cancer community a bit more.
So I definitely want to get to that, but just to sort of the TLDR, it sounds like there's that piece during treatment where you're figuring out your access to uh, some professional but some non-professional social supports. So um, you know, you might be really tired to advocate for yourself, especially during chemo, but having, our dad who was there to sort of like say, hey, like, what about this and what about this, to access, but then also um, knowing how to engage with those professional supports as well to sort of help take care of your mental and physical well-being. But then later on, you know, mental health is a roller coaster, recovery is a journey. There are a lot of ebbs and flows, and knowing when to access and what to access and how to access. So, non social, professional, but also being able to look inward and say, hey, you know what? Things are going great, or something needs to change, or I actually need to access something that I wasn't accessing 10 years later, 11 years later, saying, hey, I'm going to go to this cancer fatigue group.
Mhm. Yeah, there's a lot of different uh, steps or roads you can take. But to find the ones that benefit you the most, it's good to reflect on yourself and know what you need, because for everyone it'll be different. So you might be given a blanket plan to begin with, but being able to nuance that as you go will give you the best support for you.
Amazing. So let's talk about that cancer fatigue group and different like community supports. What exists and why is that cancer fatigue resource group something that you've taken to? How has that been helpful?
Yeah. So in December, I went to a sort of cancer survivor conference. It's called Yak, which I don't know. That's an interesting name for a nausea-inducing treatment, but it's called Yak. And going there, meeting a lot of different cancer survivors, a lot of people that are active in treatment, people that have recovered. Myself, who's been in remission for at that point 11 and a half years, was very interesting. And it's sparked my interest when I received an email saying that there's a cancer fatigue group. And this past year, I've been pretty tired. So I was like, well, whether the tiredness is from my treatment 11 years ago, whether it's from something else, being a survivor that can have resources to help me manage my fatigue was really cool. So I went there. I rode a bike until I couldn't ride the bike anymore. I went through different tests and measurements, and they created this whole plan for me. this place called Cancer Fatigue Services to once assess and evaluate and then put into plan uh, different exercises, different routines I can do to increase my ability to do activities of daily living. So I just thought it was really interesting that I had that available to me and I had no idea.
So tell me more about like, and you don't have to give the secret sauce away, but what are some of those things that you did? You did those tests, you did those assessments, you rode that bike until you couldn't ride it anymore, and they said, Michael, based on our tests, you should be doing these 3, 4, 5 things every single day, and we think that'll lower your fatigue. What are some of those things?
Well, the thing that helps the most amount of people the most, meaning the least targeted, most universal help, is exercise. So people can exercise as a spectrum. People can be doing very simple exercises, very complicated exercises, but overall that'll reduce fatigue. Whereas some people, they have anemia, it's more related to their diet, more related to cognitive overload and stress. So for me, they put together this fitness plan, which involves riding a bike slower than you'd think for like 45 minutes for like 6 weeks. And then you do a high intensity exercise while you're being monitored. And that just continues. So every 6 weeks, you're riding a bike 3 times a week. And then they see how much that increases your ability to carry out simple tasks in your day for the whole day. That's a bit of the secret sauce, yeah.
So it's less about like to reduce fatigue. It's not about doing necessarily the high intensity interval, whatever, like the big heavy weights. It's more about being able to do something small for a longer period of time, more endurance.
Endurance based, yeah. Because if you think about your day, um, bending over to get a dish from under in like a cab or above you in a cabinet, those things all take up a bit of energy. So throughout your day, you actually use a lot more energy than you might think. So you want to be able to tackle those things, especially if you are tired all the time.
So shifting back to a bit about what we were talking about before, um, one thing that I've seen a lot in forums, um, and just through some plain old googling, is trying to understand how one can communicate their ongoing needs with their family and friends. Maybe you have some needs during treatment, maybe you have some needs after treatment. You mentioned being tired. Is that something you bring up with the family? Say, hey, I'm too tired to do this today, I'm going to do this instead, but I'll see you next time. Like, how do you communicate those types of things?
These days, pretty honestly, I used to communicate less so and just sort of do whatever I need to do. But these days, if I'm overtired, right? Growing up, I'd always say I need a break. And then I had the break I needed this year, and it was very helpful. And it turns out I was right. But just simply saying it without putting too much weight on how it might be received has been really helpful.
Yeah,
We
you're one of the few people in my world who actively will just say, I'm taking a break this month. And
It's great.
I'm like, how do you even possibly take a break for a whole month? And then after you're like, wow, I just feel so refreshed. I feel so good. I really needed that. And it really makes me think how much, like, especially we live in this, quote unquote hustle culture, where if you, like, literally, if I went to a networking session and said, hey, this week I worked 80 hours, everyone would be like, wow, you work so hard. You'd get applauded for it. But if I said, hey, I'm taking a break this month, people would say, that's interesting. Maybe in a more like mindful community, you'd have some people say, oh, that's nice, but a month? But this is something you really implement all the time.
It's interesting how taking care of yourself in a way that doesn't produce an immediate productive result isn't celebrated in the same way that working until you're burnt out is celebrated. So for me, I like to celebrate my ability to steep. Like if you're a cup of tea, you'd be steeping. You'd be growing as a person. You'd be having a more internal locus of control instead of just sort of completing a list of tasks, which can be good too. You need both. But for me, I value that balance. And I'm fortunate enough to be able to have that balance as a creative where I can make my own schedules and just take a day. Like yesterday, I took the evening off pretty much. And I was like, I don't know how I'm going to fill this time. So I was like, you know what? I'll watch a movie. And then I watched the movie. I'm listening to the score. I'm like, oh, it's an interesting song. And now I've added that song to my playlist. And maybe that influences my next album or EP. So I think when you leave space for anything to come up without the need for certainty, that's when you get all of the best stuff, in my opinion.
So you mentioned that's really powerful, I think, and you mentioned something important before, where we really celebrate people who grind until they burn out, and then when somebody says, "Oh, I'm burnt out," you're commonly going to get asked, "Oh, you don't take breaks?" But it's kind of this odd thing we have right now in our culture. But how do you notice that you need to take a break when you're not burnt out? What are some of the things that you're looking for, noticing that trigger you to say, today's this evening, I'm going to watch a movie, and then whatever happens, happens, or take that month off?
A few things. One, if I realize I'm not eating properly, my sleep isn't good, I haven't gone outside. So one thing is being able to look at my behaviors and then sort of reverse engineer them. Say, okay, if these are my behaviors and I'm usually someone that can do this, then maybe something's falling through the cracks. The second one is if I become more judgmental or thinking more negatively. I tend to be a more optimistic person. So if I'm having this change in how I perceive things, then that's another sign that even if I was working more, I probably wouldn't be doing my best work. So taking a step back can actually allow me to take two steps forward when I feel ready.
Really interesting. And what I think is even more interesting, and kind of what I'm noticing, again, as I mentioned in the beginning of the episode, we have quite often on the show very well established clinical guests. But what they're noticing in their clients, their patients, whether they're a psychiatrist or a psychotherapist or whatever work they do, they work to establish baselines as well to understand what's going on with their clients. And I think it's really interesting internally to say, okay, what does baseline Michael look like? Or what does baseline Jonathan look like? Michael is optimistic. He sleeps regularly. He's very routine oriented, although he likes to have flexibility. But when those things shift, the force is off, and you have to make those are the things that you notice to say, I need to adjust. So I think that's really
Exactly.
great. Um, okay, I have two last questions, one official last question, then the unofficial last question. But really broadly, like what does the future of mental health and cancer care look like to you in your ideal world? You mentioned like in the rounds before, maybe you're inside the room and all the professionals are talking outside the room, or you were in care and you transitioned out of care and really at a pivotal point in your life. So what are some of the things that, you'd like to see for the future? Maybe somebody who's in treatment now at 17.
I think one thing is the transition from children's hospitals to adult hospitals is pretty vast. So being in the children's hospital, even in the notes, they would be complimenting me or like everyone was like super, I found nice. I had like 64 nurses and like 99% of them were super solid. I found when I went to adult hospitals, there's a bit more of an assumption that, okay, you're going through this, but you'll figure out how to manage it. There's an assumption that we don't still need that kind of level of kindness and support that we have that we desire when we're 13 or 16. Like maybe the language changes or how we're spoken to changes. But if we could establish a system that gives caregivers and workers once again more breaks, more leniency, more time to fully flesh out and integrate who they are into their practice so they have a bit more peace of mind, I think that'll translate to patients. So I think that adult hospitals would be better if the workers were able to have more energy to give that same level of kindness. Yeah.
That's really interesting. And we had a talk with one of our clinicians, Dr. Weiss, at Bellwood, Toronto, back in June, where we were talking about caring for caregivers, and we had a room full again of psychiatrists and psychotherapists, and everyone was often talking about burnout and feeling low, and how do you provide for your patients and your clients, but it's felt both ways really, and I think that's really interesting too. Caring for yourself allows you to care better for others.
Exactly. It's the classic airplane analogy, right? With the oxygen. You got oxygen yourself, and then you're able to give it to the people around you.
So it's been really great, Michael, brother, to have you on the show,
Great to be
especially
here.
today.
12 years.
12 years. Do you want to tell people what you do every month on the 26th?
Yes, every month on the 26th, 12 years would make this the 144th burger. But quick math, every month to celebrate my treatment coming to an end, I go for a hamburger. So I've gone to so many places around Toronto. Today I'm going to a place called Simple Burger. I'm very excited.
Shout out.
And every month I invite different people to come with me so that people that knew me during that time or knew me post that time come hang out and enjoy 4 ounces of burger meat.
Amazing. Um, if you have one last short piece of advice to share with listeners about starting their own recovery journey, their own journey with their own mental health, what advice would you give them?
Be compassionate to yourself. So I would say a lot of times people are very hard on themselves. And even when you're sick or going through treatment, you want to get everything done that you need to get done. But one of the gifts I was given in my treatment was the ability to slow down and reflect. And I think that everyone would have a lot more to give to the people around them if they first slow down and process who they are. So I would say be compassionate to yourself and take more breaks.
Slow down.
Yes.
Okay. Well, recovery is possible, and EHN Canada is the place for both virtual and inpatient treatment programs for mental health and addiction. To learn more about Michael's story, Michael, you want to raise the book,
But yes, this is me at 16,
the rocking chair.
the infamous rocking chair, and the only photo of me looking miserable through treatment.
I know we were talking the whole episode about how you had a really optimistic outlook, and then we have this picture.
The one picture.
Yeah, you're tired. We'll have the link to that book in the description. I think it's available on Kindle and as a paperback copy. And even more importantly, to learn more about Michael's musical journey and work there, you can check out freedmix.com. To learn more about the work we do, you can check out ehncanada.com. And the final shout out is to listen to even more episodes of FAQs and hear amazing stories from people like Michael or some of our clinicians. You can check it out on your favorite streaming platform. Michael, brother, thanks, and we will see you next time.